You know, Sanjay, maybe a lot of people don't know, but there is a doctor who is present during lethal executions, usually administering at least that first drug that renders the condemned unconscious. I'm not sure I understand how it works with the Hippocratic Oath. I thought that's not allowed.
Well, this is sticky. I mean, there's no two ways about it, Ashley. And you're right; it doesn't fit neatly into any kind of, sort of adhering by that oath. The doctors don't always actually administer the drugs. In fact, I think there's certain laws in certain states that say they cannot put in the needle or administer the drugs, but they are present sometimes to declare someone dead. That's what the doctor's role is. Many times there's doctors or nurses who are also prison employees who are part of this. But I can tell you that we oftentimes don't know who these people are. They don't self-identify, as you might guess, for obvious reasons. So you're right, it is a sticky situation, but you do have medically trained professionals who train to help people and prolong life who are now in this really uncomfortable role.
So, Sanjay, the first drug that we were just talking about, and you'll have to correct me because you're much better at this than I, is midazolam. Thank you, midazolam, and that causes the unconsciousness. But next up is the vecuronium bromide. Is that correct?
Yep, vecuronium
what
bromide.
Happens?
You know, that's a paralytic. It's essentially, it paralyzes the muscles, and that's important, actually, because in this case it paralyzes the diaphragm, which is a large muscle as well. When the diaphragm is paralyzed, one can no longer breathe.
Then there's the final drug, the potassium chloride, and it effectively finishes the job?
Yeah, it stops the heart. It causes a chemical imbalance in the body, and specifically in the blood that's around the heart, that essentially causes the heart to go into cardiac arrest.
None of that, look, I don't know a whole lot about taking those drugs and having those effects, but not one of them seems to be terribly painful to the point that it has been described in the execution last night. They called it looking like torture. What part of that, or what combination or problem with those drugs and the cocktail of those causes the intense pain?
You know, if things went the way they're supposed to go, you're right. There shouldn't be pain because the first drug is supposed to render someone essentially unaware. That didn't seem to happen in this case. If you give someone a paralytic, their diaphragm is no longer able to move, but they're still awake, Ashley. That can be that could be painful. It could be very disconcerting. You're essentially suffocating, unable to take in breaths anymore, despite the fact that you're awake. The third drug can cause a cardiac arrest, and someone might have the sort of pain associated with a heart attack, for example. So again, if the process worked the way that it's supposed to work, and all three drugs did what they were supposed to do in order, that shouldn't happen. But that doesn't look like the case here.
Well, I understand when companies, or for moral reasons, or for the Europeans who won't even extradite because of the death penalty when it comes to murder cases. But why are they not able to mimic the drugs that used to be easily readily available? Why can't they mimic them with others? And why are we having these problems all of a sudden when they go to the cocktails?
No, it's a great question. Look, since my first year of medical school, Ashley, there's a philosophical tension around that very issue. People create these medications. They want them to be used for life-sustaining, life-preserving sort of measures. To create another set of drugs, mimic drugs, perhaps a company could do that for the sole purpose of these executions. It's not a role anyone's comfortable with, frankly. And so I think that's part of the challenge. And medical establishments, the AMAs, they prefer their doctors don't be involved in these sorts of processes. Manufacturers don't. So it's a sticky ethical situation. I will say, though, in this particular case, the vein where the medications were going through, it burst open. So instead of the medications going into the blood, they were going into the soft tissue of the arm, and you could still absorb some, but you just don't know how much, and that just threw the whole thing awry.
I think that's a huge point you just made, Sanjay, that the authorities anyway, of course they pulled the curtains so we couldn't witness this, but the authorities say this was a vein issue, not a drug issue. But until we have a very thorough investigation into this, how can anyone be sure? I mean, there's so many litigation issues that could come up as well. Dr. Gupta, I could talk to you forever.
Me too,
Thank you so much.
It's
You're
always
just
fun.
great. Thank you so much, Dr. Sanjay Gupta, with all the answers all the time.